Any person above 30 to 35 years age, I recommend to get yourself screened with at least once with your blood pressure. Check your BP in hospital or at home with a blood pressure monitor to check your fasting blood sugars to know the risk of you getting diabetes, and HbA1c, which tells 3 months of your blood sugar, whether is it under the control or not. I mean, will be known by HbA1c. Fourth thing is a fasting lipid profile. Your LDL cholesterol and triglycerides will be known in your fasting lipid profile. So high LDL cholesterol is one of the risk factors for heart diseases, and high triglycerides is also one of the risk factors, especially for our Indians, for heart diseases. So these are the initial blood tests which I recommend for any person who's above 30. And there are other blood tests like ECG, electrocardiogram, 2D echo, by which you will know your heart pumping function, and whether if there is any valve abnormality, you will know in the 2D echo. And in 2D echo we know multiple things, but initially ECG, 2D echo, and as per your physician or your cardiologist, you can undergo a stress test depending on your physician or cardiologist opinion. Stress test can vary. I mean, it can be treadmill test, it can be stress thallium. There are multiple ways of stress tests, multiple modalities of stress imaging. So few of these are treadmill test, stress thallium, dobutamine stress echo. So you cannot directly walk into a lab and get all this, but based on the recommendation of your physician or a cardiologist, you can get these tests done. And for people who are above 50, 55 with long-standing diabetes, you can CT calcium score is a non-invasive modality of checking your risk factor of getting cardiac diseases. Other thing is CT coronary angiogram, but this should be under the prescription or under the consultation of a physician or a cardiologist. CT coronary angiogram, wherein you will know exactly percentage of blockages in your heart and fat deposition in your heart, especially for who are above 55, who are long-standing diabetes, who have a family history of heart diseases, and who have a risk of smoking and tobacco. So people with these risk factors, based on your physician or cardiologist opinion, you can get these tests done.